This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Isp Cough Expectorant is designed to relieve cough associated with mucus, providing effective respiratory support. Indications and uses. This medication is indicated for productive cough associated with respiratory conditions such as bronchial asthma, chronic obstructive pulmonary disease, COPD, chest congestion, bronchiectasis, and emphysema. It is effective in relieving symptoms by thinning mucus, facilitating its expulsion, and improving airway function, thereby enhancing overall breathing comfort. How it works. The formulation works synergistically through Ambroxol, which thins mucus, Guaiphenesin, which helps expel that mucus, and Terbutaline, which opens up the airways for easier breathing. Directions for use. Before using, shake the bottle well. Measure the prescribed amount using the provided measuring cup and take it after meals, typically twice daily, once in the morning and once at bedtime. It is important to rinse the measuring cup before and after use and to store it properly to avoid contamination. Always adhere to your healthcare provider's instructions for dosage and duration. Possible side effects. Common side effects may include dizziness, drowsiness, tiredness, stomach upset, and changes in taste. These effects are usually mild and manageable. Precautions and warnings. Before starting this medication, inform your healthcare provider if you have liver or kidney issues, heart conditions, diabetes, or a history of seizures. It may also not be suitable for pregnant or breastfeeding women without consulting a doctor first. Caution is advised when driving or operating heavy machinery due to potential drowsiness. FAQs. 1. What is this medication used for? It provides relief from cough associated with mucus and respiratory issues. 2. Is it safe to use? Yes, when taken as prescribed by a physician, it is generally safe. 3. How does it work? It combines mucolytic, expectorant, and bronchodilator properties to relieve cough and improve breathing. 4. What are the common side effects? Drowsiness, dizziness, and stomach upset may occur. 5. How should it be taken? Shake well, measure the dose using the provided cup, and take it after meals. Thank you for watching. If you have any questions or suggestions, please leave them in the comments below. Your feedback is appreciated.